I'm 68, and my doctor said I'd need hip replacement within a year. That was 3 years ago. These 4 stretches, just 4, saved me from surgery, and they take less than 10 minutes a day. Listen, I'm not a doctor, and I'm not telling you to skip medical advice, but I went from barely walking to the mailbox to hiking 5 miles without pain. My orthopedic surgeon was genuinely shocked at my last checkup. Here's what nobody tells you. Most hip pain after 60 isn't your joint wearing out. It's the muscles around your hip getting so tight they're crushing the joint from the outside. I'm going to show you the exact 4 stretches that changed my life. Each one targets a specific muscle that's probably causing your pain. And yes, check with your doctor first, but these could save you from a $50,000 surgery and 6 months of recovery. Stick with me for 9 minutes. This could change everything. Stretch number 1 is the hip flexor release. If you only do one stretch from this video, make it this one. After 60, we sit too much. Every hour you sit, your hip flexors, the muscles at the front of your hip, get tighter. When they get tight, they pull your pelvis forward and crush your hip joint from the inside. My hip flexors were so tight I couldn't stand up straight. The pain was constant. My doctor said, "That's arthritis. Surgery's coming." But it wasn't just arthritis. My muscles were strangling my joint. Here's the exact method. Step 1. Get into a lunge position. Right knee on the ground, left foot forward at 90 degrees. Put a towel under your back knee for comfort. Step 2. This is crucial. Keep your back straight. Tuck your pelvis under like you're pointing your tailbone down. You should feel it immediately in the front of your back hip. Step 3. Gently shift your weight forward a few inches. Deep stretch in the front of your hip and thigh. If you feel it in your lower back, tuck your pelvis more. Step 4. Hold for 60 seconds. Breathe slowly, no bouncing. Step 5. Switch sides, 60 seconds. Within 2 weeks of doing this daily, I could stand up straight for the first time in 2 years. This one stretch probably prevented my surgery. Do this every morning before anything else. 2 minutes total, most important 2 minutes of your day. Stretch 2 targets the piriformis, a small muscle deep in your hip. When this gets tight, it pinches your sciatic nerve and locks up your entire hip. I had shooting pain down my leg. 3 doctors said it was joint deterioration. Wrong, it was this one muscle. Lying down version. Step 1, lie on your back. Bend both knees, feet flat. Step 2, cross your right ankle over your left knee, makes a figure 4 shape. Step 3, reach both hands behind your left thigh. Pull that knee toward your chest. Step 4, deep stretch in your right buttock. If you don't feel it, pull your knee toward your opposite shoulder. Step 5, hold 45 seconds. Breathe deeply. Step 6, switch sides, 45 seconds. Chair version. Can't get on the floor? Sit up straight. Cross right ankle over left knee. Lean forward with a straight back. Same stretch, 45 seconds each side. After 1 week, twice daily, my shooting leg pain vanished completely. My range of motion improved so much I could put on socks without wincing. Morning and night, non-negotiable. Stretch 3, hamstrings. You're thinking, my problem is my hip, not hamstrings. Here's the truth. Everything's connected. Tight hamstrings pull your pelvis backward, which tilts your hip joint the wrong way, which causes pain and degeneration. I couldn't touch my knees without pain. My physical therapist said my hamstrings were so tight they were tilting my entire pelvis. Once I loosened them, my hip pain decreased by 60%. Step 1. Lie on your back, legs straight. Step 2. Lift your right leg straight up. Keep your knee as straight as you can. Slight bend is okay. Step 3. Loop a towel, belt, or resistance band around the ball of your foot. Step 4. Gently pull your leg toward you. Keep your other leg flat on the ground. Keep both knees as straight as possible. Step 5. You should feel a stretch down the back of your raised leg. Pull until you feel a good stretch, not pain. Step 6. Hold 45 seconds. Breathe. Step 7. Switch legs, 45 seconds. Pro tip. Point your toes toward your shin while you stretch. This deepens the stretch through your entire back chain. After 3 weeks of daily hamstring stretching, my pelvis realigned. My physical therapist measured. My hip joint space actually increased slightly because the pressure was off. This stretch is preventative medicine. Do it every day, preferably after the first 2 stretches when you're already warmed up. Stretch 4 is the 90-90, and this is the most comprehensive hip stretch you can do. It opens both your inner and outer hip at the same time. This one's harder, but it's also the most powerful. After 60, we lose hip rotation, the ability to rotate our leg in and out. This causes compensations that destroy your hip joint. This stretch restores that rotation. Use a chair. Sit at the edge. Place right ankle on left knee, like stretch number 2. Sit tall. Lean forward slightly with straight back. Feel the stretch in your right hip. 30 seconds. Switch sides. This stretch opened up mobility I thought I'd lost forever. After 4 weeks, I could cross my legs again. I could get in and out of cars without pain. I could rotate my hip in all directions. My surgeon said my hip joint was moving better than patients 20 years younger. This stretch is why. Do this 3 times per week minimum, daily if you can. Here's your exact daily routine. Every morning, 5 minutes. Hip flexor release, 60 seconds each side equals 2 minutes. Figure 4 piriformis stretch, 45 seconds each side equals 90 seconds. Hamstring stretch, 45 seconds each side equals 90 seconds. Every evening, 5 minutes. Figure 4 piriformis stretch, 45 seconds each side equals 90 seconds. Hamstring stretch, 45 seconds each side equals 90 seconds. 90-90 hip opener, 30 seconds each position, both sides, equals 2 minutes. 3 times per week, add an extra 90-90 session. This one's your deep maintenance. What to expect? Week 1, you'll feel looser, morning stiffness decreases. Week 2 to 3, pain starts reducing noticeably, you'll move better. Weeks 4 to 6, significant improvement, you'll wonder why you waited. Month 3, like me, you might cancel that surgery consultation. Critical rules. Never stretch into sharp pain. Discomfort is okay. Sharp pain means stop. Breathe through every stretch. Holding your breath tightens muscles. Be consistent. Doing this once won't help. Daily is the magic. If something feels wrong, stop and check with your doctor or physical therapist. 3 years ago, I could barely walk. Now I hike, garden, play with my grandkids, and live completely pain-free. My last x-ray showed my hip joint space was stable, no further deterioration. My surgeon said, whatever you're doing, keep doing it. I spent 10 minutes a day on these stretches. That's it. No gym, no expensive equipment, no surgery. Just consistency and these 4 stretches. I'm not special. My hips weren't better than yours. I just found the right stretches and did them every single day. If I can do this at 68, you can too. If this video helped you, hit that like button and subscribe for more honest health advice for life after 60. Drop a comment and tell me which of these 4 stretches are you going to start with. I read every comment. And if you know someone dealing with hip pain, share this video. You might save them from surgery. Remember, your body is capable of incredible healing if you give it what it needs. These 4 stretches might be exactly what your hips have been begging for. Thanks for watching. Now get off YouTube and go do these stretches. Your hips will thank you.